So the topic for today is a very small topic, but it's very important for your theory exams. Benign ovarian tumors. We have begun malignancies in gynecology. শুরু হয়েছে তো malignancy গুলো ক্লাস হয়েছে তো malignancy এর আগে okay so this is a benign topic, benign ovarian tumors. First thing, where does the ovary originate from? Embryology. Where does the ovary originate from? There's something called a gonadal ridge that develops in the 5th week. That is where the ovary comes from. Uh, the main part of the cortex arises is the main part of the ovary, and the medulla regresses, quite opposite to the testis. Normal ovary is around 3.5 into 1.5 centimeters. Okay. এটা important. Normal ovarian size, it's around 3.5 by 2 by 1.5 in normal reproductive age group, while it regresses to around 1.5 by 0.7 and 0.5 in a postmenopausal woman. And volume is less than 10 cc. This is important in PCOS. Any volume more than 10 cc is considered as ovarian enlargement. The next important part of this is this one. Any ovarian tumor or ovarian cyst can only be said if it is more than 3 centimeters in diameter. Anything less than 3 centimeters is considered a follicle. Okay, this is the classification of a benign ovarian tumors. We're going to talk about all of these, including the functional cysts, the inflammatory ones, benign neoplastic ones, and endometriomas. We're going to talk about this. The first are the functional cysts. This is the most important functional cyst. সব সময় যে কোনো আল্ট্রাসাউন্ড করলে একবার পাওয়া যাবে. These are the follicular cysts of the ovaries. The ovarian follicles, if they fail to rupture or regress, they form a follicular cysts. They're more than 3 centimeters, but never more than 8 centimeters in diameter. They're lined by granulosa cells. This is what it looks like. এরকম একটা দেখতে appearance পাওয়া যাবে in USG. They have thin anechoic walls, no internal flows, and with this is very important, posterior acoustic enhancement. That means it is fluid filled. Usually they do not rupture or cause any complications. They regress by 2 to 3 menstrual cycles. This is one more important point, a corpus luteal cyst. This one looks very much like an ruptured ectopic pregnancy. A corpus luteal cyst is lined by theca cells. It may rupture, causing hemoperitoneum, looks very much like an ectopic pregnancy. This is what a corpus luteal cyst looks like. You've heard of corpus luteum, right? When it enlarges, it becomes a corpus luteal cyst. The important part here is a ring of fire appearance. It's a thick crenulated wall with a ring of fire. There is peripheral vascular flow. This increased peripheral vascularity causing a ring of fire appearance. The last one is a theca lutein cyst. These occur in H moles in multiple pregnancy and when pregnancies are induced with clomiphene and GnRH. এইরকম দেখতে হয়. These are very large cysts, multiloculated cysts, and contain fluid enriched in beta HCG. The important part of this is you have to remember these things. This classification is important. Functional ovarian cyst is a short note. You need to write about 3 things: follicular cysts, corpus luteal cyst, and theca luteal cyst. Okay. As I said, management amon kichu nei. Just wait for 2 to 3 cycles. If it does not regress, you can go for an OCP management, 3 to 6 months of oral contraceptive pills. Very rarely they require surgery, especially in corpus luteal cyst. Okay, the next part is the inflammatory ones, a tubo-ovarian abscess. এটা already আমি বলেছি একবারে, PID এর মধ্যে হয়, contains pus. Endometrioid cyst or chocolate cyst is another one. Something like this, a chocolate material cyst. These are either anechoic cyst or contains low level internal echos. I'm going to come to the important part. Okay. তোদের যেটা পরীক্ষায় লাগবে সেটা হচ্ছে হাউ ডু ইউ ডিফারেন্সিয়েট বিটুইন এ বেনাইন অ্যান্ড ম্যালিগন্যান্ট ওভারিয়ান সিস্ট। বেনাইন অ্যান্ড ম্যালিগন্যান্ট ওভারিয়ান সিস্ট, হাউ টু ডিফারেন্সিয়েট বিটুইন দোজ। আমি এক একটা বেনাইন সিস্ট নিয়ে কথা বলবো, বাট লেটস ডু আ ডিফারেন্সিয়েশন ফার্স্ট। This one. Memorize this table very well. This is what you're going to write in the examination. How does a benign ovarian tumor differs from a malignant ovarian tumor? Any ovarian tumor that occurs before menarche or after menopause is most likely a malignant tumor. Okay, this one at the extremes of age, before menarche and after menopause is most likely a malignant tumor. Next one is pain. Pain is an unlikely symptom in a benign ovarian cyst, but it is very common in malignant cysts. Edema, as in pedal edema, that occurs due to extreme pressures on the abdominal veins, causes pedal edema. Again, a symptom of malignant ovarian cyst. Similarly, varicosities also occur because of pressure on the abdominal veins. This one, a benign ovarian cyst is usually unilateral, whereas a malignant can very well be bilateral cysts. Okay? Exceptions are there. There are bilateral benign cysts like fibroma and bilateral cysts like serous adenomas. This one, unilocular, it is multilocular. What is locular? Loculations mane? Compartments. The cysts will have compartments. So your benign cysts are usually unilocular, whereas your malignant cysts are multilocular. Even if even if your benign cysts are multilocular, the septations will be very thin, less than 3 millimeters. This one, septa. Even if your benign cysts have locules, the septations will be thin and flimsy. Okay, this one, very important. Your benign cyst will never have, very rarely will have solid components. Any benign cyst which is solid, any idea? Benign cyst which, yes, very good. A dermoid cyst contains solid components. Anything else? Are কিছু solid component থাকে? Completely solid benign cyst. This will be your MCQ questions. Completely solid benign cyst. Huh? Yes, solid. Tumor, not cyst. Okay. বলতে ভুল হয়েছে, tumor. Benign tumor which is solid. Completely solid. Yes. Okay, I'm going to come to that. Wait. Ask. The other part is your benign cyst will be slow growing, smooth and cystic, and freely mobile without any ascites in the abdomen. Whereas malignant will be irregular, large, rapidly growing, as well as contains some ascites. And it will be fixed with some nodularity inside it. This table is very important when you have to write a differentiation between benign and malignant ovarian tumors. Okay, here. আমরা এই ছটা benign ovarian tumor নিয়ে পড়ব. All of this can come as a short note. তার মধ্যে important হচ্ছে dermoid and Brenner's. These two are important for your short notes. So first is a serous cyst adenoma. What is a serous cyst adenoma? কি থাকে ভিতরে? It will contain serous fluid. Serous বলতে, what does serous mean? Clear watery fluid. Okay. In comparison to mucinous, which is thick gelatinous fluid. This one. This is usually a benign cyst, can be bilateral. Achha. It has something called psammoma bodies. This is important. It has psammoma bodies. This is more important in malignant serous cysts, which contains more number of psammoma bodies. This is what it looks like. একদম clear fluid পাওয়া যায় ভিতরে, large cysts, very thin wall with clear fluids. See this USG এর মধ্যে কিচ্ছু নেই, just একটা black area. This is clear fluid cyst. And absolutely no vascularity anywhere. No increased vascularity either on the periphery or in the center. Next comes a mucinous cyst. Look at this appearance. এই appearance-টা দেখ. This is multiloculated. See, multiple loculations, but all the loculations are thin and flimsy. Contains some gelatinous fluid. It is lined by, since it is mucinous, Everything that secretes mucin is lined by goblet cells, right? Pathology, anything that secretes mucin is lined by goblet cells. This one is also lined by goblet cells. See an MRI picture, কত সুন্দর এবার দেখা যাচ্ছে যে this is all gelatinous fluids, it's not clear fluid. In comparison to this, see, this is clear fluid, ekdom. Whereas this is a gelatinous fluid. Okay, this is the important part. What is a dermoid cyst? A mature cystic teratoma. Teratoma means something that arises from the germ cells. Okay, it contains components from all the three germ layers. What are the three germ layers? Ectoderm, mesoderm, and endoderm. Ectoderm থেকে কি আসবে? Skin and nerve tissues. Mesoderm contains muscles, bones, cartilage, and endoderm will contains intestine, gut wall, and all the endothelial linings. See, it contains everything of this. A cyst, something like this. It has hair, it has sebaceous material. This is tooth. These are tooth inside the ovarian cyst. It's a very common tumor, very common in pregnancy also. Pregnancy মধ্যে maximum ovarian cysts that occur are either theca lutein cyst or dermoid cyst. সব কটা endothelial, সব কটা germ layer থেকে আসতে পারে. All three germ layers. This is a very common type of benign tumors, usually unilateral, and it undergoes torsion very commonly. What is torsion? Torsion of the ovary? It twists around. It's an acute emergency. When it twists around, blood supply is cut off to it. যখনই কিছু twist হবে, this firstly venous occlusion followed by arterial occlusion. The tumor becomes very large, congested, and becomes very painful. This is important. There's something called a Rokitansky protuberance. এগুলো সব pathology পড়িয়েছে. Rokitansky's protuberance. It is a solid nodule within the dermoid cyst where usually the bone or teeth appears. Looks something like this on an USG. This is the protuberance. This is the Rokitansky's protuberance. This is the common benign solid neoplasm, fibroma. The only thing you need to remember from fibroma is this one, a Meeks syndrome. Fibroma ovaries causes something called a Meeks syndrome. It's a triad of ovarian solid mass, ascites, and right-sided hydrothorax. What is hydrothorax? What is hydrothorax? Inside where? Where in the thorax? Yes, within the pleural cavity. It causes hydrothorax. This is an MCQ question. Meeks syndrome কোন ovarian tumor হয়? It is common in fibromas. It's a triad of three things, that's why. Pseudomyx. What is pseudomyx then? There are two things. There's something called pseudomyx, there's something called pseudomyx. Okay. Pseudomyx is something, triad is the same. It contains ascites, hydrothorax, but it does not contain a fibroma. Anything other than fibroma, other malignant tumors হোক যেখানেই হোক ascites-এর জন্য, malignant ovarian serous cyst adenocarcinoma, mucinous cyst adenocarcinoma, তার সাথে যখন associated ascites or hydrothorax আছে, that is called pseudomyx. Okay? Whereas there's something called pseudomyx that occurs in SLE. SLE এর মধ্যে যখনই তোর without any ovarian malignancy or ovarian tumors, when there is ascites and hydrothorax, that's called pseudomyx. There are two pseudos in that. This one, an ovarian thecoma. It contains theca lutein, not lutein, theca cells. Again, a solid tumor. The one thing you need to remember is it secretes hormones. A thecoma secretes hormones. If it secretes estrogen, it causes feminization. If it secretes androgen, it causes masculinization. That's all you need to remember from this. Brenner's. Brenner's is a very unusual tumor, very uncommon. It contains urothelial epithelium. What is urothelial epithelium? bladder epithelium. Okay, this is an ovarian tumor which contains bladder and kidney epithelium, transitional type epithelium with abundant stroma. Again, it can secrete some kind of androgens and causes virilization and masculinization. Something it looks like this is transitional epithelium. You don't need to remember much from this, just that it's a very uncommon tumor, contains transitional epithelium. That's it. We have something called stromal and sex cord tumors, which are granulosa and the Leydig cell tumors. Again, not important for you. You don't need to remember this. Okay, how does an ovarian mass present? Clinical presentations for an ovarian mass. What can be the symptoms? Written here, asymptomatic. Most benign ovarian masses are found inadvertently while doing an ultrasound. They don't create any symptoms. Ovarian masses which are causing symptoms like pain and torsion, acute pain, are usually malignant unless there are complications to it. It causes abdominal swelling if it is a large mass, causes pressure symptoms on the bladder and the rectum, and something called a menstrual disturbance. যেটা বললাম, hormone secreting tumors. We have 2 to 3 hormone secreting tumors like a theca, Leydig cell tumors, androblastoma, and Brenner tumors. If it secretes estrogen, it causes precocious puberty, breast enlargement, and endometrial hyperplasia, as well as postmenopausal bleeding. If it secretes androgen, it causes deepening of voice, acne, hirsutism, and virilization. Oh, and amenorrhea. Important thing. Testosterone থাকলে amenorrhea হবে সবসময়. When you examine it, general examination খুব কিছু পাওয়া যাবে না. There may be pallor, there may be some tachycardia, and there may be cachexia if it is very large. What is cachexia? What is cachexia? Shudu, only. What is cachexia? What is cachexia? Medicine হয়নি এখনো? You have done liver disease in medicine, right? Anyone, what is cachexia? এরকম অবস্থা হলো তো মুশকিল. Anorexia along with weight loss is known as cachexia. Anorexia along with weight loss is known as cachexia. Okay. On abdominal examination, you will find on inspection there may be a swelling, there is edematous skin, there is varicosities on the abdomen, increased venous prominence. This is the important part. On palpation, you will find a smooth, rounded mass with regular margins. It is a cystic appearance and mobile. An ovarian mass is mobile from side to side, but not up and down. Okay, whereas an uterine mass is mobile up and down, rather not side to side. Okay. We have to differentiate a large cyst adenoma from ascites. We can differentiate it by fluid thrill. What is fluid thrill? What is fluid thrill and what is shifting dullness? Palpation হবে. What does it signify? Fluid thrill কি বলে? Abdominal fluid আছে, তাই না? এবার how do you differentiate whether this fluid is generalized like in ascites or it is within a cyst like cyst adenoma? How do you differentiate an enclosed fluid and generalized fluid? Shifting dullness. How do you do shifting dullness? Laterally চলে যাবি যেখানে tympanic পেলি, lateralize the patient, সরিয়ে দিলি, your point of tympanic will go even further. If it is a enclosed cyst like a cyst adenoma, তাতে কোনটা পজিটিভ হবে? Fluid thrill, shifting dullness, কোনটা পজিটিভ হবে? Fluid thrill পজিটিভ হবে because it has fluid. Shifting dullness কি হবে? Will this fluid shift? It's enclosed, it cannot shift. That is why you do a shifting dullness to differentiate ascites from enclosed fluid, like any cyst. Okay? See, fluid chill and shifting dullness will be positive in ascites, but shifting dullness will be negative in cases of ovarian cysts. Okay. Simple. Management is very simple. তার আগে একটু investigations নিয়ে কথা বলি. We'll talk about some investigations. These are routine investigations. We don't need to talk about this. General medicine or surgery will tell you. These are all the routine investigations we do in any operative case. What we need is ultrasound. Ultrasound is the first and foremost investigation for any ovarian mass, suspected ovarian mass. Almost 90% differentiation can be done on the basis of ultrasound, whether it is benign or malignant. আমরা already characteristic গুলো বলেছি benign malignant. We have something called, you understand there is abdominal TVS and TAS, transvaginal ultrasound and transabdominal ultrasound. Okay. This an iota classification for benign rules and malignant rules. On ultrasound, any unilocular cyst with solid components less than 7 millimeter and acoustic shadowing. These are the symptoms for a benign ovarian mass. Whereas anything with an irregular solid tumor, ascites, and internal blood flow will be a malignant mass. Not important for you. Again, not important. Yeah, this is important. Tumor markers. What are tumor markers? What are tumor markers? Tumor markers are blood biochemical investigations that tell you whether this patient is supposed to have malignant tumors or benign tumors. We have many tumor markers. তার মধ্যে important হচ্ছে CA125, CEA, beta HCG, alpha fetoprotein, and CA19-9. Look into tumor markers is a short note again. CA125 is very highly specific as well as sensitive for epithelial ovarian cancers, especially in postmenopausal women. Any CA125 more than 35 international units is considered as positive. Okay, it is used in all the criteria for determining whether the patient has malignancy or not. We have something called an RMI, risk of malignancy index. We have something called ROMA, ROMA. All of these are uses CA125 as its guiding criteria. It is elevated in 80% of cases epithelial ovarian cancers. Epithelial cancers মানে হচ্ছে your serous, mucinous, your Brenners, and dermoids. Especially sensitive in postmenopausal women. CEA, carcinoembryonic antigen. This is important because it is raised in mucinous adenocarcinomas. It's not important for you. Management. What do we do in cases of ovarian masses? This is a flow chart of this. If your ovarian tumor does not contain any cystic mass, you do not go for surgery. Simple protocol. If your ovarian mass does not contain any solid components, you do not go for surgery. If it is less than 5 centimeters, you observe this patient, follow up every 3 months, and if it regresses or remains the same size, you do not do anything. If it is more than 10 centimeters, you go for surgery. And if it is between 5 to 10, you go for a conservative management for 6 to 8 weeks, and then you go for surgery. These are the indications for surgery: any solid ovarian lesions, papillary projections, and any mass more than 10 centimeters. Kichu boite eta 7 centimeters so ache, you can write both. Maybe more than 7 centimeters, more than 10 centimeters, both. And if it undergoes torsion or rupture. You can go for two kinds of surgeries, either laparotomy or laparoscopy. Laparoscopy is preferred. And in young women, you have to go for ovarian preservation. You have to go for cystectomy and not oophorectomy. This is very good. Anyone heard of frozen section? What is frozen section? What is frozen section? Yes. Intraoperative, we take small samples, we send it for immediate biopsy. Normally, a biopsy takes around 4 weeks to come. HPE takes around 4 weeks. But this takes 30 minutes to come. So this is very important. আমরা যখনই suspect করছি benign or malignant, we can go for a frozen section. This is another question for you. Complications of an ovarian cyst. Remember this acronym TRIUMPH. Okay. Torsion, rupture, infection, impaction. What is impaction? আটকে যাচ্ছে. Very good. Adhesions, ascites, malignant change. Achha, what is pseudomyxoma peritoni? What is pseudomyxoma? Yes, appendix se hoy, appendicular malignancy. Appendicular adenocarcinoma, there is complete ascites within the abdomen, which is known as pseudomyxoma peritoni. Also happens where আর কোথায় হয়? Mucinous adenosia. Okay. Pseudomyxoma peritoni and hemorrhage. আমি দেখ কতগুলোকে বোল্ড করে রেখেছি আর কিছু নর্মাল ফন্টে আছে. The bold ones are the important complications that occur commonly. Torsion, rupture, infection, ascites and malignant change. These are what occurs commonly. The rest are uncommon. Torsion. Torsion ovary is a very important short note. Anybody explain to me how torsion occurs? How does a torsion occur and which tumor is more likely to undergo torsion? Dermoids is very good. Jantish? A dermoid cyst is more likely to undergo torsion. There is some criteria that has to be fulfilled in order for a mass to get torsed. Number one, it has to be large. Okay? It has to be large. Number two, it has to be buoyant. It cannot be a heavy mass. It has to be a light mass. Dermoid cyst usually contains sebaceous fluid and fat. It becomes a very large and yet a very light tumor. তাই জন্য হালকা হওয়ার জন্য ফুটবলের মতো ঘুরতে সুবিধা হয়. Okay, number two. Number three, it has to come out of the pelvis. No mass can undergo torsion while it is in the pelvis. The pelvis does not provide enough space to undergo torsion. It has to come into the abdomen. It has to become large enough to come into the abdomen in order to undergo torsion. Okay. Number four, it has to have a very long pedicle. Pedicle মানে হচ্ছে something that is attaching it to the walls. Ovary is attached by the infundibulopelvic ligament and the ovarian ligament. It has to undergo torsion on these ligaments only. Achha. Firstly, যেটা হয় সেটা হচ্ছে there is always a history of violent movement. At a jump or something, a violent movement. ছোট্ট একটা twist হয়. After that twist, what happens is there is continuous pulsations of the ovarian artery. These pulsations aggravate this twisting. Once there is 1.5 turns, there is venous occlusion. Venous occlusion হওয়াতে কি হচ্ছে? Arterial blood flow পৌঁছাচ্ছে, but nothing is coming out of it. There is increased encasement of the blood within the ovary. The ovary becomes black, large, edematous, as well as hemorrhagic. পুরো কালো হয়ে ফুলে যাবে ওভারিটা. If it undergoes further torsion, 2.5 tons, there is arterial occlusion. Once the artery gets occluded, it becomes ischemic. Ischemiaর পরের step হচ্ছে necrosis and the ovary dies. If I can salvage this ovary, if I can go for a surgery before necrosis occurs, I can preserve this ovary. What do? I do for an ovarian cystectomy. I do a detorsion and I fix this ovary. This is called ovariopexy. I'll fix the ovary somewhere so that it cannot rotate any further, either on the lateral pelvic wall or on top of the uterus. In benign ovarian tumors, there are 2 to 3 things you have to remember for your examinations. Number one, how do you differentiate a benign tumor from an ovarian malignant tumor? What classification of a benign ovarian tumor? And 2 short notes, that is dermoid cyst and Brenner's tumor.